So for the person that is either headed to dentures, can't save their teeth, or they're already wearing a denture, you say they could get a full arch of teeth that either snap in, snap out, or they are permanent with dental implants.
Absolutely.
So what are the options?
So if someone comes in and they already have a denture placed and they're just miserable, because lower dentures, we actually have a term in dentistry, we call them floaters, and that's for a purpose because they just don't, there's nothing to stick to. They float around. Every time you swallow, they even move. So chewing is impossible. Chewing hard and crunchy foods and the things that people enjoy is very difficult. So patients tend to have a soft diet full of processed foods and they can't chew the same. So what we can do is anything from having a couple of implants placed so the denture can snap in. Now it's stable. Now they can eat more foods. It's not going to move around on them. They have a little bit more maintenance when there's only a couple of implants placed. It's still a denture, but it's stable. Then you can have a few more implants placed, and that snaps in much more securely. You're eating apples, you're eating corn on the cob, you're eating spare ribs, you're eating nuts, you're eating carrots, salads, things like that that you haven't been able to eat in years. But it's still a denture. You still have to have some plastic maybe
so
covering
it snaps
everything.
In, snap out.
Snaps in, snaps out. Great option. And then you can move up to having a full complement of teeth that are permanent. So there are implants and mortar. You have a few extra implants. It's supporting the restoration. They can be made out of porcelain, so they look lifelike, and they don't come in and out. That is the closest you can get to having your teeth back, even better than they were before.
Now what about the roof of the mouth?
They're perfect.
Still covered?
Not covered. Nope, uncovered. So now you feel the hot and the cold foods. You can taste spices. You can taste your food again properly. Because when you have a denture and everything's covered by plastic, it feels strange when you can't feel ice water. It feels strange when you can't feel your warm soup. Nothing tastes the same. Our palate is covered by taste buds, just like your tongue. And so when that's all covered up, you don't taste things the same. You can't enjoy your food. You can't enjoy your wine. You can't enjoy things like you used to. You certainly have to change your diet. You can't chew properly when you have a full denture that's not snapped into something. So implants are changing lives.
So is this the newest trend in dentistry?
Absolutely.
Like nobody should be wearing a loose-fitting denture.
No one should be wearing a loose-fitting denture. Even if you're on a budget, you can have, like I said, you can have as few as 2 implants placed on the bottom jaw. Something that you can snap.
Just locked in.
Lock it in. Yes, and there's no reason why. It's very affordable. It's painless. It's not a long, drawn-out procedure. And there's no reason why anyone should be suffering with dentures in this day and age.
And you do it all right there. I mean, you do it
We do.
all right there. You don't have to send them out in most cases?
We do it all right here, yes.
But what about pain? It seems painful.
It's absolutely not, and especially because we offer sedation, and so most patients opt to have sedation, so they're sleeping through the procedure anyway. They're not feeling a thing. It's very pleasant, very comfortable. When they wake up, they have their teeth that are snapped onto something. There's very little post-operative discomfort. There's absolutely no reason to let the fear of discomfort or pain during the procedure deter you from having this done because of sedation. Blood pressure is monitored. Everything is very safe. And it's wonderful. Patients love that.
Now you offer financing at your practice. Are people financing dental procedures? I mean, is
Absolutely.
it common?
It's so common.
Oh, really?
I mean, very few people want to come in and pay for everything immediately or up front, or they need to have something that fits into their budget, and we absolutely can find something that fits into their budget. If someone has ever bought a new car or has financed anything, they know that they wouldn't have been able to go in and put down the cash and drive away in that car. Very few of us do that.
Yeah.
Most of us have a car payment. And it's the same concept as that. If you want to find something, if there's something that you need and want, there's no barrier. We are going to find something that's going to fit in your budget. It's going to work.